But this then stood out to me as a really strong example of a company that has really leaned into podcasting and done more than simply dropped a podcast and tried to drive traffic to it, but has in fact not only grown a network around its primary podcast show around health information, but also has even created a network of other shows and sells advertising into it. It's actually created a business out of it. And this is, and I'm talking about Providence St. Joseph Health. Mary Renouf is the VP of Community Engagement, Clinical and Patient Communications. She is presenting this and will be talking about a really interesting podcast program. Take a look.
Hello, everyone. I'm Mary Renouf, Vice President of Community Engagement and your Chief Clinical Communications Officer for Providence Health System. I want to thank you all for being here today, and I'm so sorry I couldn't be there in person, but I did still want to spend some time talking to you a little bit about our content marketing strategy at Providence, and why it's such an important tool for us and how podcasting has really become a vital part of that work. As one of the largest not-for-profit health systems in the country, our goal is to deliver world-class health for all, meaning that everyone has access to really good quality care. And in the world of marketing and communications, where I sit, that means providing access and awareness. It means using our teams to build our brand through all the traditional paid channels, as well as leveraging our owned and earned platforms as well. My team is very heavily focused on education, enhancing and empowering our patients and our caregivers and our communities. And we do that through a robust content strategy. We use all of the traditionals that you can think of, your Facebook, your Instagram, your LinkedIn, your Twitter. We look at the emerging categories, TikTok and Snapchat, and as well as blogs, but also podcasting. In fact, we focus so heavily on creating these beneficial and free resources that we've also been able to partner with some of the bigger platforms themselves. So, for example, we offered a lot of COVID education materials very early on during the pandemic, and we would take that information and we would put it out in real time, day to day. We would be updating, and so we partnered with Facebook to become their official COVID health education partner, and then that actually has transitioned us into, we are the official health education partner for TikTok Learning as well as Meta Education, and we're actually having conversations with the Meta Health team as well. In all honesty, I could spend a whole another hour talking just about our content strategy alone, but really the primary focus of today in this session is to talk about our podcast strategy. Let me take you back a few years when podcasts really started making a resurgence in popularity. I think at the time we were reading stats like 70% of Americans were listening to podcasts. And so we decided to really make it a priority for our organization. With the depth and breadth of our clinical expertise, our executive thought leadership, our innovations team, we really felt like we could offer free resources that would make an impact for people in a way that was comfortable for them, right? You know, you don't have to show up at a certain time. You can listen to a podcast in your own time. You can listen to it on the train. You can listen to it while you're working out. You can join halfway through a season. So we thought this was a chance to give people what they needed in a way that felt comfortable for them. At the time, Dash Radio was making a really big impact on the streaming radio market. And because we are disruptors of healthcare, changing the way that we access care, that we deliver care, that we finance care, we like the idea of partnering with other change makers and disruptors. So we forged that partnership with them. At the time, they were the fastest growing streaming radio player. They were dipping their toes into audio casting and video casting. They were very early entry into the metaverse. So for us, it seemed like a no-brainer to kind of ride their coattails just a little bit and help a large health system that maybe doesn't move as quickly get into those spaces. So through that partnership, we started with a single show. It was called The Future of Health. And the idea was to deliver education and information about the changing world of healthcare. We did crossover appearances with existing talk shows. We had some of their hosts as guests on our show. We had some of our clinical experts as guests on their shows. We even did a live takeover of their Dash studio in Hollywood, which was very funny for us because we showed up with clinical researchers at the time. And I think right before we showed up for our show, there was like an Ice-T and a Snoop Dogg mashup. And so it was just really interesting to watch our clinicians see kind of this transfer of the studio and be like, oh, that was interesting. But a whole nother story. When we saw that this show was starting to gain traction, right? It was going from 2,000 listeners a day to 10,000 listeners to 50,000. We thought, we should maybe make this into a full station. And that's really the impetus for Dash Radio's Future of Health 24/7 health education station. At the time, we were definitely the first health system with our own radio station. I think we might still be. We started with Talk with a Doc, which is still a crowd favorite. I think it's the one that gets the most listeners. And that's really, for us, a chance to highlight physicians across our system. One day it could be a podiatrist, and the next day it could be a diabetes expert. Then it could be a bariatrics person, and then it could be somebody who's focused on, hip replacement. But it gives people a chance to ask physicians questions when you maybe wouldn't want to schedule an appointment to ask a question, or you don't want to do a copay to ask a simple question, but you don't trust Dr. Google, right? You want an actual authentic voice, somebody that you trust. And so we source our questions. We do it through social media. We do it through web chats. We do focus groups. We get these questions. We sit down with a doctor for 30 minutes and we just answer them. And sometimes they're silly questions, or maybe they're things you wouldn't want to ask your doctor because you're too embarrassed. I did a show one time, Below the Belt, where it was simply all questions from women about things that happen below the belt. It was really interesting. But from there, we added shows like Let's Finish Cancer, which aren't just about education, although it's great because we can talk about clinical research trials, we can talk about emerging technologies, but we also can talk about how to cope, right? We can talk about, what the family experience is when you get a cancer diagnosis. We talk very much about just kind of what's changing in the realm of cancer, right? Something where a diagnosis you had maybe 10 years ago was a death sentence. Now maybe the survival rate is 50%. And if you live 5 years after that, it's another 50%. And so it's really about giving people information, but also inspiring them and giving them hope. That also then started the Let's Talk Mental Health, right? And so mental health is very similar in that we talk a lot about the world of mental health. What is it? What are the signs of it? How can you have a conversation about it? Like if I'm a mom and I think my 14-year-old son maybe has anxiety or depression, how do I start that conversation? And so we bring in experts. We bring in experts for youth mental health, for geriatric mental health, for BIPOC mental health. And we ask those questions, we answer those questions. We have very basic shows about men's health and women's health. We have things related to our mission of our organization, change makers, people who are really changing the world of healthcare. We talk a lot about how do we make the healthcare world a better place for people. And so it's not, it's not just fun. It's very much education and it's very much helpful. And I think what we like best about this is that it gives people a chance to enter into your health system in a way that feels safe. It's free. I can do it on my own time. I can listen to that podcast on the treadmill. I can listen to it on the train. I can come in halfway through a season, or I can start the season. I can replay it. I don't have to commit to the whole thing. I can listen to half the show and not, right? It's not like I showed up for a diabetes education class, decided it wasn't for me, and left. I didn't have to get up in the middle of a seminar and walk out. I just hit pause, right? And so it really gives people that chance to experience and engage in a comfortable way. It also gave us a chance to really speak to the consumers about what they care about. Not just in that digestible format, right, that we talked about, but really what is it they're looking for? So we ask people, during COVID, we started putting out that information I mentioned, but people really wanted to talk about youth vaccines. They were having so many questions. They want to talk about masking. What's the right way to wear a mask? How long can I wear a mask? Do I wash my mask? Can I make my own mask? So we started answering questions and really became this accessible healthcare system that could provide that information for you in real time. And that's what the streaming radio piece offered for us, was that ability to turn it around really quickly. It also gave us that chance to explore those kind of critical topics that don't also get a lot of attention. We focus a lot on healthcare equity. We talk about the mission-driven health organizations. We talk a lot about finance of healthcare. I mean, sometimes if you think about what's the most challenging aspect of healthcare, aside from maybe getting your physician appointment, it's reading your bill. It's knowing that the specialist you're going to is covered by your insurance. So people have so many questions about healthcare and the way that we finance it, that became one of our shows. And now we went from this one show to this full-time station, and we're averaging around 300,000 listeners a day across the world. I would say 80% of them right now are US based, and the second and third countries are English speaking countries as well. Although we are starting to see a pretty big growth in Mexico and some of the Spanish speaking, which now is kind of our next effort, right? We are very much focused on Spanish speaking content. So we've done quite a few episodes in Spanish, but we've never really done an entire season or a show dedicated to in language. And so that's kind of our next step. You're probably saying to yourself right now, though, I thought she was going to talk about podcasts. Why is she talking about streaming radio? Well, let me dig in a little bit, because I think the connection will be there for you. Once we got this relationship and once we started building these shows and we were able to get them re-recorded, we really wanted to optimize that full potential, right? So we did turn them into podcasts. We turned them into audiocasts. We turned them into blogs. We even do replay of virtual live events. With each show, we stream it on the radio, so it maybe gets 1 or 2 plays. I think some of our shows we run it, say, Monday and Wednesday, at 9 a.m. We get the show streamed live, right? So people are listening to it on Dash. Then we get it turned into the podcast, and then it goes through a podcast network. So you can listen to it on Last.fm, Apple, pretty much anywhere that you listen to podcasts, you can hear our podcast. We turn that into a blog, as I mentioned. We have several social media posts promoting it. So that one 30-minute session with a physician is now getting turned into 6 or 7 activations. And so it's very efficient. It's very optimal. We also are able to take advantage of our influencers as well. So anytime that we're working with influencers, we carve out time to record those podcasts. So it could be at the beginning of a video shoot. It could be at the end of a video shoot. If we have a doctor or an influencer on set filming any form of a video for ourselves, we make sure to capture that in podcast form. And so we can turn that into something else. And it's a very efficient use of our clinicians' time. It's a very efficient use of our executive time and our influencers. So I guess what I'm trying to say is our podcast went from being a nice to have education program to being a pivotal component of our marketing communication mix. A lot of times when we get briefed in on a marketing campaign now, what we're asked is, how many podcasts can you create that I can then turn into my advertising content? So rather than creating a commercial, maybe we're using some of the podcast content that we created. And a lot of times when we capture this podcast, we do capture the video with it as well. So, you'll only hear the audio portion, but the video portion exists as well. And it turns really into really nice social pieces. It turns into nice, content that we can actually put paid media dollars behind. So it's really an interconnectivity to a lot of the other work, which has also made it very visible. Our physicians actually, in the beginning, we struggled to find people. Now, we'll do an interview with a physician who will say, hey, did you know that this other physician in my practice does this new procedure or does this new technology or sees, a type of patient that nobody else sees? And so we're actually getting referrals, and we're getting a list. Right now we have a list of physicians who want to do shows, that so many that we actually don't have the time to capture them, or we don't have the right shows for it to fit in, which then generates potentially a new show. In fact, I mentioned the below the belt one earlier. There were so many questions about that. Like, women, your health in your 20s is different from your 30s, is different from your 40s, is different from your 50s, right? Women's health below the belt is different than above the belt. And so it actually has been the genesis of an entire series of women's health. And so each series, or each, I guess I would say season, is focused on a different generation of health. So women in their 20s may listen to it. Women before their 20s may listen to it. When you're hearing the 40s, you might be listening to it in your 30s thinking, I'm not too far from my 40s. And so it's nice to see how the pieces come together, and it's really nice to see how our physicians get really on board with it, and they love to use the content for their websites as well. So we actually hear physicians say, hey, if I do your show, can I put it on my website? Or can I have my patients listen to it? Can I send an email with a link? And so it's really been nice to see them get fully engaged into it. The last thing I'll say about that is that it really also has turned into a potential revenue stream for us. So as we've partnered with brands to create custom shows and episodes, for example, we worked with Boston Scientific on our men's health series. So we had Providence physicians who were talking about conditions and procedures that they treat within our Providence health system, but they treat them with Boston Scientific products. And so when we were filming this, it just became this natural way of talking about it. And so we were actually talking with Boston Scientific, would you like to come on the show and talk about the technology? And they said, not only would you like to come on the show, we'd like to sponsor it. We'd like to do a whole series of this to talk about the different technologies. And it's not one of those like, hey, you have to listen to an ad, or this show is brought to you by Boston Scientific. It's very much a natural, organic integration. And so Boston Scientific is the benefit of being able to showcase how their product gets used through the voice of a clinician, and oftentimes through the voice of a patient who comes in and talks about the procedure they had with the physician. But it just feels organic. It feels natural. And so we've got several partnerships like that in the works right now, some that are coming to fruition, some that we're still working on. And then we just have a few of them that are pretty organic and that you can hear at any point in time. So I think, it's always nice in healthcare, especially in the financial crisis we're all in, to find a way to, if not just to be net neutral, which is fabulous, right? To run a station that costs you nothing in the long run because you're recouping those dollars, but potentially to bring in dollars as well. And so that for us has been really beneficial. I would say, in order to do something like this, you really have to have executive buy-in. It's been easy for me to continue to grow the station because over the last 3 years, we've seen huge success. I think we've produced 600 shows. We're averaging 300,000 listeners. We've used, I think, over 500 clinicians and influencers within our system and given them a voice. Each show gets, I don't know how many thousands of replays, but it's really nice to be able to go back to a physician and say, you gave me 30 minutes of time, and here's what I was able to do with that. I was able to get, 300,000 listeners during the first day. I was able to get this many replays. I was able to, deliver this many social views of it. And so it makes them feel valuable because they are. It lets them know that you value their time and their expertise. You're not just using them because you need an expert, but you use them because they're the right expert and you're using their time efficiently. And I think in the world of healthcare, especially in the world of marketing communications for healthcare, developing those relationships that are mutually beneficial is huge in order to continue to get those physicians to show up when you need them. We've really embraced a content marketing strategy at Providence that does the education for us. It does the enhancement and the empowerment of our patients. It gives us a chance to talk to future patients. A lot of those listeners each day maybe have never heard of Providence, or they didn't even think about Providence. And now they look at their insurance and they say, oh, I could go to Providence. And I know Dr. So-and-so there because they heard the show. And so I think when you have results like that and you have something that gives you this potential to grow, it's really exciting and it's really fun. And so, I was able to show the executives very early on that we believed that this would be a beneficial thing for us. It might cost us a little bit of money to do the partnership, to have the staffing, to create the content. But we believed that it would be mutually beneficial for our physicians and our patients. And so fortunately, our executives invested in it. And then now, in year 3, 4, and 5, we're actually making money from it. And we're seeing these numbers grow and we're seeing these positive engagements and we're getting people asking us questions. So many questions that I don't even think we could do enough shows to answer all the questions. But I think it just says, podcasting has really become a key component in our content strategy. It's helping us deliver that free information. Everybody wants to be the Mayo Clinic, right, when it comes to education. And I think that through this tool, we are really showing that we have a deep bench of experts. We have resources, we have access, we provide between our system. You can come into our system at any point in time and you can travel throughout the system. You could see a specialist in Seattle and then find out that you need to have a very, complex surgery, and you can do that in our California system. And so I think building that national name recognition for a health system through podcasting has been incredibly beneficial for us. So we only see it growing. We see the benefit in it. It doesn't mean that podcasting is going to be, the be all and end all for everything. Things are going to change, right? Like I was mentioning the metaverse, we potentially may have a station in the metaverse where potentially you could listen to a show and then go into your virtual experience and have a telehealth visit right there. Or you could, do a research and see what it might look like to have a surgery. So I think we're always looking for what's the next big thing, but podcasting has continued to benefit us. It's continued to grow. We have not seen a dip in it. I think the numbers continue to grow pretty substantially quarter by quarter. And so for us, it was definitely worth it. I hope that I was able to get you excited about podcasts and content strategy. I thank you so much for your time today. Again, I'm very sorry I couldn't be there in person, but I am happy to take your questions via email or connect with me on LinkedIn. And I look forward to hearing from you all. Thank you so much for your time.
Go ahead and clap. She's tuning in. Thank you, Mary.